As many would expect, the Centers for Disease Control reports that the COVID-19 pandemic has caused a number of mental health challenges, including depression, anxiety, and has in some cases increased substance use as people are coping. The MassSupport Network is offering free and confidential support services to individuals and families who are struggling. I spoke with Gaer, the Western Mass team leader, to learn more.
So MassSupport Network is a really interesting program because we only exist when there's been a disaster. So for Western Massachusetts, the last time that we had MassSupport Network was after the tornadoes, which I had the honor of being the team leader for that program as well. We are a FEMA-funded crisis counseling program, and sometimes people get confused with the word crisis. In the context of this program, the word crisis is actually referring to the disaster. And so we have counselors throughout Western Massachusetts who are available to provide a pretty vast array of services. A lot of the work that we're doing right now is running self-care coping groups with school personnel. But we also do a lot of one-on-one support conversations with folks. We are trained in psychological first aid. And so we are able to help people temporarily, which what we find is that most people just need some temporary support. In cases where someone may need more than that, we do make referrals to community organizations. But our program is 100% confidential. The only recording that we do is of things like demographics as far as age, gender, race, and presenting issues. But we don't maintain any records as far as phone numbers or email addresses. So we are completely confidential and anonymous. And people can reach us either through our email address or through our 1-888 phone number.
So this pandemic obviously has changed life for everybody. I mean, it shut businesses down, people have lost their jobs, and then you have isolation, and you have people who have lost family members. I mean, there's so many big issues that really is affecting mental health. I mean, what are you hearing from people as far as, what is the biggest struggle?
It's really, I use the word interesting, but for my line of work, it is interesting because usually when we look at disasters, you have the people who had very direct impact, like the tornado. Everybody had some level of impact, but most people were able to move on fairly quickly, except those who were very directly impacted by it. But the pandemic, COVID-19 is different. What we're finding is that everyone has been impacted and many people in many different ways. The bare minimum is that we're all impacted around kids being able to return to school or being able to go to our work and do, normal socializing events, right? We're all wearing masks. Life is different for everyone. And then we are, of course, finding people who have been even more directly impacted. Either they have been infected themselves or someone they know and care about has been. And so it's interesting because historically we had to figure out who was impacted and try to support them. But in this instance, it's everyone, everywhere is being impacted. Some of the most pressing things that we're seeing is really concerns around children and education. So families are struggling immensely with both kids not returning to school and also the fears around kids returning to school. So a lot of our work right now is really to try to help support families, parents, and teachers.
How do you advise parents, and how do you advise, different school administrators, what to look out for?
Certainly some of the research out there that I've seen does suggest that substance use is on the rise across the board. I haven't seen anything specific to any one age group, but that across the board it is on the rise, and that is concerning. Because especially when we talk about young people who are at risk for suicide, if they're living in a home where there is substance use occurring, that's going to increase their risk. So, the way that we think about it, or that I think about it, is that all prevention is actually suicide prevention. As far as whether kids should be going back to school or not, I think I'm at as much a loss as everyone else out there is. We're all trying to figure out how to maneuver in a pandemic. And there's certainly a lot of unknown and a lot of fear. And so part of it is gauging the anxiety that we're all feeling and trusting, the CDC and the experts from the Department of Public Health who are making these decisions. At home, it's going to sound overly simple, but I think one of the best things that we can do is all work really hard to be kind to one another. and to understand that each and every one of us is struggling in this time.
I think you hit on something on that, though, because we know, like, if you just look at, general news cycle right now, being kind to one another is really a really big thing. I mean, I think obviously the pandemic, there's all the headlines, of course, with racial injustice and police issues, but being kind to each other, I feel like people are so easily, I guess they get angry, understandably easily now. That's a big dynamic.
Well, and here's the interesting thing about that, Carolee, is we actually know that one of the phases of the disaster that people experience on a widespread level, we call it the disillusionment phase, right? So in the immediate aftermath, we often have the honeymoon phase of the disaster, which is exactly what it sounds like, right? There's a lot of coming together and cohesion, and we saw that this time with all of the gratitude for our healthcare providers and people putting the hearts up in the windows. After 9/11, we saw it with people putting flags out and bringing food to police and fire departments. So that honeymoon period is very consistent in a disaster. A lot of people don't realize that once the honeymoon wears off, we go into what they call the disillusionment phase. And in the disillusionment phase, we're often seeing increases in substance use, a lot of anger and irritation and frustration. A lot of that cohesion that we saw in the honeymoon period sort of falls apart. And that's actually what we're seeing right now. Whether it's on social media or it's in the news, there's an awful lot of anger. And while some of it, as you said, is absolutely, totally justified, in my experience, that anger and communicating with anger doesn't usually bring about the change that we're hoping for. So I still fall back on my belief that trying really hard to be kind to one another is probably the best path forward.
And what is your advice to parents as far as, if they're concerned about their children? You mentioned social media. A lot of what kids have now, or all they have, is social media. How do you advise them moving forward, no matter what the school year is going to look like, just really to take care of themselves?
So the first thing that we advise is actually to the parents is to take care of themselves. That if mom and dad are struggling, if they're really stressed out, if they're drinking or using drugs, that is gonna impact the kids. And so the first thing, it's kind of like on the airplane when they tell you, right, to put the oxygen mask on yourself first. And we really recommend the same thing for parents. Make sure that you're taking good care of yourself. And if you are able to be calm and present and supportive, your kids are going to be that much better off. But again, it's really difficult because we do tell people to limit screen time. And for kids who are going to be going to school remotely, they're already going to be getting a lot of screen time. And so I think a lot of this is going to be learning, spending time with each other and being creative about how to spend our time outside of screen time. So, we certainly encourage people to do their research, but learn about outdoor activities that, can respect social distancing and, those sorts of things. But doing things as a family is really important.
Okay, Sarah, Gaer, thank you so much for joining us, and thank you for all this great advice. We appreciate the work that you're doing in our community.
Thank you so much. If I could just leave people with information about MassSupport Network, you can find us at MassSupport.org, or you can send an email to massupport@riversidecc.org. And our 188 phone number is 888-215-4920. And you would leave a voicemail and a counselor will return your call within a few hours.